Now let's talk about this deep cup-shaped portion which is called as the acetabulum. It is basically formed by the junction of the three parts of the hip bone, the ilium, the ischium, and the pubis. Acetabulum is a hemispherical cavity on the lateral aspect of the hip bone, located almost in the center of the hip bone. If we take a closer look, the acetabular cavity is deficient inferiorly. This deficiency is known as the acetabular notch. Now you have a better understanding of the acetabular notch. Please remember that this transverse ligament bridges up this area. Now you might be wondering what is the function of the acetabulum. It is the formation of this ball and socket joint with the head of the femur. There is this fibrocartilaginous acetabular labrum that is attached to the margins of the acetabulum, which deepens this cavity and helps in the formation of highly specialized mobile joint. Now, situated anterior-inferior to the acetabulum is the large gap in the hip bone called the obturator foramen between the pubis and the ischium. It is large and oval in males and small and triangular in females. It has a covering which is known as the obturator membrane, but it allows the passage of the obturator vessels and nerves through a defect in the membrane. Now we have come to the end of the anatomy of the hip bone, the important landmarks that we have discussed, and the muscular attachments on the three major parts of the hip bone, including the ilium, the ischium, and the pubis. Now we'll move on. How are you going to identify whether a hip bone is of a female or of a male?